Cervical cancer is the second worst cancer worldwide for women, but it is one of the most preventable and curable cancer if HPV virus is detected earlier before it causes cervical cancer. Mostly, it affects women who are above 30 years of age. In Kenya, 4,802 new cervical cancer cases are diagnosed every year. Among the 4,802 cases, only 2,351 women survive, meaning 2,451 women die annually due to cervical cancer.
Yeah, HPV is one of the tests that we do in the molecular department, and HPV is a viral infection that is caused by human papilloma virus. HPV itself, the virus itself, is the one that causes the cervical cancer. So it causes the cervical cancer if it's persistent and if it stays for 5 to 10 years in the body. Yeah, so that's why it's very, very important for a woman to do screening regularly. So when we do the screening, the doctor will now know if you have the HPV. He'll know, is it the high risk? So because we have there are many HPV, there are more than 100, but 14 types are high risk. That is the 16 and 18, which is the most high risk, and then the other 12 are also high risk. Doctor will know, will I have to see the patient after 6 months or after 1 year? Because within 6 to 18 months, the infection is supposed to clear by itself. So the pap smear is it's a test which is regularly used in Kenya, and it's always checked for the cellular changes. But the HPV testing, mostly it checks for the virus itself. So when you do the HPV, it's better because you're able to know then if I don't have the virus, I can stay with like 3 to 5 years without doing the pap smear. Because most women don't like doing the pap smear because it's discomfort, embarrassment. Yeah, because you have to go to the doctor, you'll feel discomfort, you'll feel like your privacy is intruded. So they feel like they really don't want to do this test.
Pathologist Lancet Kenya has a new technology of detecting HPV virus before it develops to cervical cancer. Using a device called Evelyn brush, one is able to collect the vaginal sample at the comfort of her home.
So the V brushes, with one testing, can yield valid samples. This is the plunger, and this is the cap, the pin cap, and these are the indicator wings. With these indicator wings, the patient is comfortable knowing that the length will not hurt the patient, because you have to insert this in the vagina, and then the brush has very soft and flexible hair that get the samples from the vagina. When you are getting your samples, there's a click sound, a feedback sound. So when you're doing the rotation, you have to do 5 rotations for you to get enough samples. So every rotation there's a sound, the click sound. So that sound makes assures the woman like, yeah, I'm doing the right thing. And after getting your sample, you pull the plunger down and close it with the pin cap to do the testing. So the Cobas 4800 has 2 parts. It has the X480 and it has the Z480. So the X480 does the analysis of the samples. So that's where the sample DNA for HPV is extracted, and then the Z480, it does the amplification. So with the Z480, this is the Z480, it does the amplification, and we are able to know if the patient has this virus, we are able to know the genotype. That is it 16, is it 18, or is it the other 12? So this technique, it's easy to use, and because any sexually active girl or a woman, if they are sexually active, they will eventually get the HPV. So the advice it's very important to do the HPV testing.
Pathologist Lancet Kenya has a branch along Ngong Road, 5th Avenue building opposite traffic area. For only 3,500 shillings, you can prevent and reduce your chances of getting cervical cancer using Evelyn Brush. Reporting for Habari Kibra, I'm Sumaya Ibrahim.